Welcome back. Now, out of Ghana's over 26 million people, 650,000 are said to be suffering from a severe mental disorder, and a further 2,166,000 are suffering from a moderate to mild mental disorder. The treatment gap is 98% of the total population expected to have a mental disorder. 2016 really saw the mental health sector's challenges, with the main psychiatric facility running out of basic and essential medicines, and also the facilities owing creditors for goods supply. Stakeholders, many being the NGOs in mental health, have raised concerns about the way mental health care is handled in Ghana. Now, tonight we are here with a new team in place, with a new Minister of Health taking place. Our key question is, what should be the focus in terms of mental health? And we have Humphrey Kofi, who is a country facilitator for the Mental Health Leadership and Advocacy Program, and also the Executive Director of the Mental Health Society of Ghana. He's here with me. Good evening, sir. Thank you very much for joining us. So,
thank you for having me too.
Great. Now, mental health is a big deal.
Very well.
And I know that in developed countries, some countries do well in terms of advocating funds for research and how to improve care and treatment for people who are mentally challenged or who have some form of mental health care. I know also that the mental health in Ghana has faced serious challenges. I made reference to the 2016, the challenges of running out of essential medicines and all of that. The challenges we know. Now, a new Minister of Health has taken over. What will be your expectations of how his focus should be in order to address these problems once and for all, or at least begin to address them?
Yeah, thank you very much. And let me congratulate the incoming minister, Honorable Ajimamenu, to the seat as the Minister for Health. And to also mention that indeed we have perused the manifesto of the New Patriotic Party. We haven't seen clearly anything in relation to mental health, but we want to believe that he has some focus area related to mental health. And for us as civil society organizations in mental health, we first of all want him to look at the legislative instrument, which is supposed to give administrative directive to the mental health law, which is the parent law. Indeed, if you look at the legislative instrument, it talks about the sources of funding for mental health. And it also prescribes that the Minister for Finance decides how much and where the sources of funding should be for the mental health fund. The mental health fund has been inaugurated, but government has not made any commitment. I must say, any commitment to the fund. It's only the
so when you say commitment to the fund, yes, you mean contributions to the fund?
Because the law is a law that is supposed to revamp mental health in Ghana. And a key aspect of the law is the establishment of the fund. And funding, because you have already mentioned that last year we experienced so many demonstration strikes in the psychiatric hospitals because there was no funding for medicines, there was no funding for feeding, there was no funding for hospital consumables, and therefore there was a whole upheaval at the hospital. And those who were really suffering were those who were suffering from the conditions, and not necessarily the nurses. The nurses feared their security because their security was threatened.
Especially when the conditions of the patients deteriorate.
Certainly so, certainly so. And therefore, even if you got hurt as a result of the behavior of a patient, what is the compensation that you're going to get? So they were scared in that direction, which was genuine. But beyond the legislative instrument that is supposed to also look at the fund, we want to also look at the infrastructure. In the 3 psychiatric hospitals, the infrastructure is nothing to write home about. The roads leading to the place, all the 3 or especially the 2 psychiatric hospitals, Ankafo and Pantan, are so much in a deplorable state. And also, some of the lands that are even in Pantan are being taken up by private developers. I mean, Pantan Hospital was established by Nkrumah to serve as a psychiatric hospital for West Africa. That is why it has that vast land. But go and look at it. Most of the land that is supposed to belong to the hospital is now being taken away by private developers. And I think that the minister should look at that again. Otherwise, it will come to a time that we'll have
no land, no Pantan Hospital,
where we have good ideas, fantastic ideas, but no land. So that is another aspect. Again, we want to look at human resource. How many psychiatrists do we have at the moment? We have only 16 psychiatrists for a population of about 27 million. And you look at the ratio and ask yourself how many of the population to one psychiatrist. In Nigeria, we have about 150 plus, 150,000 plus, of course, with a population of 150 million beyond. But if you look at the ratio of that of Nigeria and Ghana, we stand
So what's the missing link with the Ghana situation? Is it that more people are not being encouraged to go into psychiatric training, or they're not being incentivized, or the available training institutions are just not there? Why?
In Ghana, we are not serious with mental health. Mental health is thrown, it's a secondary thought as compared to issues of hepatitis, hypertension, diabetes, etc. But anything that anybody does starts from the mind, and that is one thing we're losing focus of. You talk about reproductive health is good, but if you link reproductive health to mental health, or if you look at the relationship between reproductive health and mental health, you see that mental health is very critical to ensure that there is proper care for maternal health and etc. So mental health is something that we need to
is pushed to the background, and you believe that if we focus a little more on that as a country and gave it priority, it will help encourage people to go into that training. Let's look at awareness. I know that stigmatization of mental health, those who suffer conditions, and even those who work in mental institutions face all forms of stigma. Otherwise, if you go to nursing training, why would you choose to do general nursing when mental health nursing is in high demand, for example? So a lot of people talk about societal change so that we all get to appreciate and have a fair understanding of how mental health sits into the general health framework. But what role should the media be playing in that?
Yeah, the media has a lot of work to support reduce stigma within the communities and within the working environment. Indeed, a psychiatrist once told me that even they who are the psychiatrists who look after these people with mental disorders are seen to be mentally ill, because it is believed that once they work with them for a long time, they just behave like them. But in any case, the psychiatrists are the ones to determine who is mentally ill. You know, the issue of stigma runs through families. And for that matter, people or families with such conditions hardly come out to show or to bring their victims out for treatment. Many of them, either they resort to the traditional healers or prayer camps, or they let the psychiatrists come to their homes. There are many big people, if I say big people, people of high places in Ghana who have these conditions, but they allow psychiatrists to come to their homes to look after them. But these are few who get access to quality
and can afford it.
Exactly, and can afford. What about the many people? And we believe that indeed the minister has also to look at the National Health Insurance Scheme. Currently, what we have is the policy in terms of mental health is that it is free. Mental health services is free. But if it's free and the services are supposed to be free and the medicines are not there, are not in regular supply, then we are looking at the area of the National Health Insurance taking care of all the diagnosis in terms of mental disorders. Because if you look at this,
currently it's not so.
It's not so. I mean,
but then you said it's free. So which aspect of the mental health treatment is free?
Yes, I mean, by policy, any mental health condition is supposed to be free.
But it's not so.
It's not so, because one, you go to the hospital, you buy the folder, you buy this, you buy so where lies the free? And even when it comes to the medication, it's not available. But what we are saying is that if you look at the Chris Antim report, which reviewed the National Health Insurance Scheme last year, we made a proposal to them saying that all the mental health disorders or diagnosis in relation to mental health disorders should be put on the National Health Insurance Scheme. I mean, the report is ready lying before government. We believe that once a white paper is issued, that aspect will be carried out. That is what we believe strongly, because that's the way forward. If we know that we cannot supply the medication and people are run, in fact, those people who are suffering from mental health conditions and are in the hospitals, are in the offices, are more than those who we see nude under the trees. Yes. Because there are many of them in the offices that either are aware or are not, that they are suffering from some conditions like that. Many of them too, they know, so they are on their medication, but their colleagues may not.
So, let's move the discussion a little bit and wrap up. Our time is up.
Okay.
But I know that many people, when they're sick, they go to faith-based institutions and all of that, rather than seeking health care because of the issue of stigma. How is your association and other institutions working with faith-based groups to ensure that they redirect some of these cases to the appropriate place to get appropriate care for the clients?
Yeah, thanks. The mental health law recognizes faith-based organizations and prayer camps, because Ghanaian as we are, in Africans, of course, you cannot force somebody not to go to the prayer camp.
Okay.
If that is what he believes in, that it is only through prayer that I can have my cure.
Then so be it.
Yes, so be it. You can. That is right. But what we encourage the faith-based organizations and prayer camps to do is to work closely with the community psychiatric nurses to incorporate orthodox medicine into the spiritual healing that they are doing.
Yeah.
Because, for instance, if you have an aggressive patient, you want to calm down, you don't need to put the person in chains and shackles and flog the person. You can use other orthodox medications to sedate the person, and then you have access to the person, and then if you have to pray for the person,
you do.
Then the issue of compulsory fasting and all that is also an abuse of their rights, because you don't have to let the person fast if he's not ready.
Yeah.
You don't have to flog the person and most of them too, they expose these people under very serious conditions. If you meet some of them where they keep the patients, it's so horrible.
It's so horrifying.
A grand violation of their rights.
Mr. Kofi, I'm afraid we'll have to wrap up our conversation, but I'm grateful that you joined us. Mr. Humphrey
Thank you very
Kofi is a mental health practitioner.